All right, question 2. All right, I'll let you read through that one. Tell me your thoughts. Any options that we should eliminate? Okay, right away, you should break down that case event. Who is my patient? A patient with major depression. So your mind should automatically go in towards the subject of what is the appropriate nursing care for a patient with major depression. All right. They've been showing signs of impaired social interaction. So part of you may be thinking that if they're depressed, I need to kind of stimulate them and motivate them and get them going. And that could be fine. But also look at what your query is. Which intervention should the nurse implement? So remember nursing actions. You want to fix the problem. We may not be able to truly fix them out of this major depression, but we can do some things that are going to help the patient. So, two things: fix the problem, help the patient, keep them safe. Especially with major depression, you want to make sure they're not at risk for suicide. All right, we got some answers coming in. Option C. Are we keeping that one or eliminating? All right, we're saying eliminate A and possibly C. All right, got a couple C's. So initially, when you break down this query, what intervention should the nurse implement initially? Remember, this is a priority word, and it usually, when you're doing a nursing action, it means what's the first thing I'm going to do. So a couple things with priority nursing actions. It may be the first thing. It may be initially is a little bit different word because it's focusing on priority. The first thing you need to do. You also need to think about the subject or the diagnosis. There's some things that you're going to do early. So initially might mean early in the game, early when they first get there, versus something I would do later as the patient's getting better. So you also want to think about those types of options when you're looking at initially. This is a good question to use comparable and alike options. You want to eliminate anything that's similar. They're kind of doing maybe some similar actions for this patient. All right, so let's go back through elimination. Eliminate A, provide activities that include group interaction. Yes, very good. Usually group interaction is once the patient's more stable, they're progressing well. We've kind of done some other therapy, other nursing interventions in between. Maybe there's meds, maybe there's some medical interventions that we're doing, and they're ready to start group interaction. So that's usually later. All right, anything else that we want to eliminate? Are we sure? Are we stuck on C? Any other thoughts on this one? All right, so let's see. Let's look at B. All right, are we eliminating B or maybe deciding on B? All right, so with B, that option is saying to provide activities that allow for decision making. So what you want to do is go back to your facts. Major depression, initially, initially, will I be encouraging activities for this patient to help them, or encouraging activities that will allow them to make decisions? Is this a good time for them to make decisions? Very good. Eliminate beef. All right. Awesome. Awesome. All right. So initially, not a good thing for them to do. Decision making, group activity. So you might start seeing the similarities now, that these are things we would do later when the patient is a little more able to focus better. Right now, in the early initial stage of this major depression, we're preparing interventions, and these two things are kind of later on. So you may be looking at that as what's comparable, what's alike. They're both things they can do later, but maybe not in the very beginning. Not the first thing we want to do, not early. All right, so we're down to the last two. Which one can we eliminate? Are we going with C? Are we keeping C? Are we eliminating D? Any last thoughts on this one? All right, got eliminate D. Okay. All right, any other thoughts? All right. So now, once you're down to the infamous two, again, you want to go back to your facts. My patient's major depression, showing signs of impaired social interaction. Which intervention should the nurse implement initially? First thing, what's early? And use comparable and alike options. This is your number one testing strategy to help you eliminate options. So we notice that later they're going to do group interaction. Later they can be a little more focused and can do decision making. What else would they do later? Are they going to do minimal concentration later? Or do we want them to concentrate and focus later or early? Yeah, someone mentioned, oh, very good. Positive. That's another way you can look at this. What's positive and what is not quite negative, but maybe something they would do later on. The word improve is a positive word. So that's true. All these, the A, B, and C, are something that we want the patient to eventually get to, right? We want them to participate in group interactions. We want them to get to a point where they can make decisions because the major depression isn't as effective, or it's not, the symptoms of it isn't preventing them from concentrating and focusing. And then C is also an activity where they have to be able to concentrate and focus. So if although I want them to get to that point, if I provide activities that cause or that require them to concentrate and focus, that is something that they're going to have to do later. You want to see that patient having the ability to do that early on. So this is a later. If you're looking at comparable and alike, this is later. Minimal concentration is a little bit negative. It's kind of what's going on with the patient, right? That she's not going to have very good concentration. And that is probably the best that we can do initially, because when you're dealing with a lot of these psychosocial disorders, you want to gradually increase whatever positive activity we're trying to get them to do. If you remember doing some of the questions, we had a question with patient with OCD. I think that's on the psychosocial activity exam. And it said to tell the patient to decrease their time that they're hand washing. Well, that's not something you would do initially if they have OCD, because they're going to be more and more anxious trying to wash their hands, because that decreases their anxiety. But gradually, you're going to have them gradually decrease that OCD activity. So D sounds a little more negative, but if you notice, the key to this was paying attention to initially what things would be later, what things would be initially, early on, the first things you're going to do. So D is your answer. We're eliminating A, B, and C. So your testing strategy there, initially, comparable and alike, what is later versus what is early on. What's the first thing? I call this Nclex opposites. If they're asking me about something I'm going to do initially, and if the options are going that way, that's something I would do later for the patient versus early on, then I want to group those things that they can do later as the patient becomes better and improves. All right, that was a tough one. That was a tough one. I think everyone was thinking maybe C, but D was your answer. So this is a slide on depression. So you'll get a copy of this. Just remind me to send out these notes to you. There's a few things about if a patient is on antidepressant meds, observed for suicidal tendencies. So these are things that are highly tested on Nclex. So some good information to review. All right, so clients with depression, they are struggling, usually struggling to interact with others. We should give them time to adjust to the environment. All right, so the nurse will accomplish this by initially providing the client activities that require minimal concentration. Okay, starting out. And then as they improve and they show signs of improved mood and concentration, then the nurse will implement all the other interventions, all those other three that were comparable and alike. Those are things that they would be more likely to do later on. All right, very good question. It's just how they can trick you because you see that, you look at it and you might think, oh yeah, that's what I want them to do. I want them to improve their concentration, but initially, would I give them those type of activities?